there generally isn't a good chance of getting it, though some people have been fortunate. And again, it's the end of the vial. There's no more, there are no more patients coming up and they happen to be there. Our providers are not going to throw out vaccine. They're going to look for people to vaccinate for sure. I would say the odds are low though, for people who are lining up. And I have seen, images of people who are just waiting to get lucky and get called. That shouldn't be the standard for most people. Like, you shouldn't have to go and sit and wait for a vaccine like you would for concert tickets, right? We should have a much more efficient system where, again, through our technology, you get a text notification like, hey, if you're in the area, come in and get the vaccine. That, if we had a broader public health kind of response to this that was much better coordinated, I think that's the experience that you would have had.
There have been a lot of folks that have gotten the first dose of it that still need to get the second dose, and then they're not sure if they can get onto the website. And I know that you and the group recently clarified, yes, you're in the system, you will get your second dose. So can you just expand upon, people getting their second dose of the vaccine versus the people who haven't gotten the vaccine yet? How does that break down?
Yeah, and that's a great question. The second dose is really dictated by the public health officials. So the public health officials generally reserve a second dose for those people who've gotten the first dose. And then it's up to us to then inform them when their second dose is available. So, having said that, when people are trying to get in to manually schedule that second dose and they're getting frustrated by it, it's on the back end, our technology already is aware of them, knows that they need the second dose, and will inform them again when the public health officials make the vaccines available to us. So it should be a smooth process. An additional component is that generally you get the second dose 3 to 4 weeks after your first dose. Now the CDC has come out and said, it's okay to get that second dose up to 6 weeks later, providing some additional time for those patients to get in with the second dose.